Okay, anytime.
Good evening. Good evening. Good evening, Jerry. How can something so small demand so much attention? For 10 years, I volunteered with the annual Thomas Jefferson Prostate Cancer Awareness Day, which is held in September. What began as a simple request to volunteer quickly became a passionate commitment to help inform, to encourage screening, and to take on a bigger role. Professor Byers and fellow classmates, today you will learn what prostate cancer is, its symptoms, and who is mostly affected by it. In the United States, prostate cancer is the most common form of non-skin cancer in men. In 2010, approximately 15% of men diagnosed with this disease died. Statistics may be one thing. Statistics may be one thing, but the severity of this disease became also too real to me when it took on a face. My friend, Kevin, which is usually alias. I've known him for as long as I can remember. And like clockwork, every year in September, he would receive a call from me, inviting him down to our annual event for prostate screening. And every year he would say no. Have you ever suggested something to someone and they just completely ignored or asked them and it's something that's important? Perhaps if it was a TV reality show or a trashy novel, I would have let it go. And if he showed no symptoms, of which 50% of men don't, I could understand. Kevin however, had every reason to listen to me. Not only is he male, which instantly makes him a candidate for prostate cancer, he's African American, and he's at that age group. He's over the age of 50, and he has a history of this disease. To make matters worse, he experienced other symptoms of this disease. Pain in his upper thighs, frequent urination, and pain and burning when urinating. What is this small thing that demanded so much of Kevin's attention? It is his prostate. The prostate is located just below the bladder. It is part of the male reproductive system. It produces fluids that make up part of the semen. It's about the size of a walnut. Prostate cancer occurs when the cells of this organ don't grow normal, which is an abnormal cell. What Kevin didn't realize was prostate cancer screening is used to detect prostate cancer before any symptoms occur. The tests routinely done are a DRE, which is a digital rectal exam, and that's when the doctor, male or female, inserts their fingers through the rectum of the male to feel the prostate for any type of abnormality, meaning it could be an enlarged prostate or nodules. This is what they're feeling for. Or a PSA, a prostate-specific antigen test, which is a simple blood test that tests for prostate cancer also. According to Dr. Gamella, chairman of Jefferson Urology, co-author of the Oxford American Handbook, he believes that there are benefits and risks to having prostate cancer screening. The benefit is early detection. The earlier the prostate cancer is detected, the more better you can get treatment for it, the more effective treatment. The risks are, there's a false positive risk, meaning that you can get the prostate screening test and a blood test and it could be elevated because of other exercises before taking the test. And you can get a positive reading stating that you have prostate cancer and you really don't. So some men get treated for something that they don't have. Since other factors like enlarged prostates and prostate infections exist, it's better to get the DRE, which is a digital rectal exam, and the PSA, which is the blood test, because if it's elevated, we still can detect it with the digital rectal exam and possibly a prostate biopsy if we need to go any further, which is we take 12 to 18 core pieces of the prostate and we send it to pathology to see if there is any cancer there. As you may have already figured out, Kevin was positive for this disease. He had several treatment options: hormonal treatment, which is a lupron injection, which they believe lupron, BCGs, and Zoladex, which they believe that those injections can slow up the process of cancerous cells. Does it work 100%? No. We can do chemotherapy treatment, which is a common term used to describe the cytotoxic drug known to destroy the cancer. Some of these side effects bring on nausea, vomiting, mouth sores, fatigue. The procedure he chose to go with was the radical prostatectomy. The radical prostatectomy is the removal of early stage prostate cancer before it affects any other part of the body. The tests that are done to make sure that this doesn't happen is a body scan, which is done in nuclear medicine, and it's a bone scan of the whole body to make sure it doesn't move any further into the body. Then we do a bone scan, then we do a CT scan, of the abdomen and pelvis to make sure it's not in the bottom lymph nodes. He chose to do that. Kevin's case seemed to be pretty cut and dry, just to cut out and remove the prostate, but it wasn't that easy. The procedure had a negative and social and psychological effect on him. He was scared and he fell into a deep depression, knowing that he was diagnosed with this disease. He withdrew from his family and friends. His significant relationships failed due to the development of impotence, which is often associated with this disease and its treatment, meaning that after you're diagnosed, you're really mentally not there wanting to be physical or intimate with your loved ones. Because of the medications that you take and before and after the procedure, you're not sexually active for 6 to 8 months if you don't have any problems afterwards. Well, he knew going into this treatment, he was not fully prepared for this emotional fallout. You must understand, Kevin's father died of this disease, having prostate cancer. His father was not the most supportive. He wasn't really active in his life or anything like that. And he didn't support him. However, before his father passed away, he gave him one piece of advice: get your prostate checked, because it was hereditary and this is what he died from. However, before, he was really fighting against getting it done, but once that happened, he just got it done. Due to what his father said, he emotionally and mentally, he recovered somewhat a little. He views his situation as having a second chance at life. He established some ties with his family and friends, while some of his relationships never recovered. The biggest twist is that now he calls me when there are upcoming events. Which is crazy. It's amazing that this walnut-sized organ that sits below the bladder can cause such a drastic change in your life. When its cells fail to grow abnormally. It demands much attention, but as my friend Kevin said and demonstrated, prostate cancer is not a death sentence.
So what we have is we have a 5 for